lot to, you know, to lot to do and have to do it quickly, so I
Yeah.
figured it's easier for you.
Usually we would like shadow you for a week and
Uh-huh.
like
Yeah.
professions, but now we have to do 4 professions and I have to Zoom call all of them. So it's kind of weird this year. It's a little bit more than it would have been, but
Right. Well, and I hate too, you don't really get a really good feel, to be able to come into the office. And I mean, if you're ever free or you have a day off or something and I mean, you're welcome, to come in. I'm sure our doctor would not not mind at all for you, so if you wanted to. So
thank you. Yeah, it kind of sucks that we have to like miss out on that because like we see all the like seniors in the past like doing
yes,
all their internships, like they all take pictures and stuff and like they
right,
document it. So
right,
it kind of sucks that we're like missing out on that. But it's
yeah.
interesting that they like found a different way for us to be able to at least
Yeah, yeah, yeah. Now, I mean, I guess you have to be flexible and just go with the flow right now. So
yeah. This year is all over the place already.
you're right. I know your mom and I were talking about volleyball, last night, and Riley just in her unfortunate situation. So I really appreciate you being willing to help her.
Yeah.
Still waiting to hear from Beach South if she gets a bid from them. So anyway, it's kind of all over the map right now. But she's been offered a bid at Spike Force, and then if she does well at this kind of makeup try, well, I think they're going to have her the 15s, 16s, and 17s are trying out this weekend. So I think she's going to actually have them or have her just scrimmage a bit with them, and then they'll make a decision and they would bump her. She's an alternate bid for a higher team. So if she does well, then she'll be able to move up to that other team. So anyway, we'll see. So okay, well, I'm all ready when you are.
Okay, so I'm basically just gonna ask you like in order the questions I had sent you
Yep.
yesterday.
Okay. Yep. That
So
sounds good.
where did you attend college and what is your degree in?
Yep. So I actually went to the University of North Carolina in Chapel Hill, and very strangely, I have a radio, television, motion picture communications degree. So completely unrelated to chiropractic. Anyway, we'll get to that point in a second, explaining that. So
So did you go to graduate school and like do you feel that it was necessary to?
well, you have to. So, in order to become a chiropractor, especially in the state of North Carolina, the state of North Carolina requires you to have a bachelor's degree before you pursue your chiropractic degree. So, once I figured out, after UNC that I wanted to become a chiropractor, then I had to apply for chiropractic college, and I went to Life University, which is in Marietta, Georgia. It's just northwest of Atlanta. And it's a 3.5 year program. So it's 14 consecutive quarters. So in addition to the 4 years of undergrad, then another 3.5 years of, specific to chiropractic.
So how did you like find out about this job?
Yeah, so interesting. After I graduated, well, let me back up a little bit. The summer after my junior year at Carolina, I interned at Fox 8 here locally. So after that summer, I really decided, oh, I love television and I wanted to get into broadcast journalism, specifically sports broadcasting, because I love sports. So after I graduated from Carolina, I moved to High Point, and I was interning at Fox 8. And of course, that does not pay bills. So I was waiting tables at Longhorn, on Main Street, which of course is still there. So, I was carrying all those crazy heavy trays and developed kind of a neck and a shoulder problem. So ended up and weirdly, the chiropractic office that I work in now, as a patient. And after being there, I don't know, a couple of weeks as a patient, Dr. Stroud, which who I work with now, asked me to come and work in the front office. So I was working in the front office during the day, waiting tables on the weekend, and trying to intern at Fox 8, in the evening, and some on the weekends as well, because I still thought that's what I wanted to do. But I was earning money working in the chiropractic office. And strangely enough, I have a younger brother, and while I was working in the chiropractic office, he was in a very serious automobile accident. And I mean, they were wanting to do all these crazy surgeries, and the chiropractor that I work with now said, wait a minute, let me refer you to a colleague of mine in Southern Pines, because that's close to where I I grew up, and he had a lot of serious side effects, from the car accident. And within just a couple of weeks of being under care, all of his symptomatology resolved. So it just was a big, eye-opening, amazing experience, for me and my family, that everything was 100. I mean, he actually had a compound fracture in his femur, so where the femur actually came, out of. So, I mean, really to this day, he has a lot of trouble with his knee just because, anytime you have that serious but all their like neurological symptoms, they all resolved. And to this day, he has no issues with that. So that really influenced me. I'm like, I would love to be that to people, for a profession. So shortly after that, I applied to chiropractic college, and off I went. So
Wow, that's amazing.
yeah, it's weird how all the, how it all works out, but it did. So
Yeah.
that I decided to pursue chiropractic.
I've been going to the Healing Hands
Yeah,
by
Damien.
they've been
Yeah.
helping me because like just from volleyball, like you get messed up. So
Yeah, no, you do.
problems and like shoulder problems. And literally I just noticed like I've only gone twice and I'm doing like I think like a 10-week program or something.
Okay.
And
Yeah.
like I already feel like so much better. I'm like, wow, I
Wow.
can move.
Yeah, no, it makes such a difference. And I was talking with your mom last night. Your body, you require so much of it, and at such a high level, and obviously moving on to the collegiate level as well. You're not immune from injury or trauma, so you have to have that person that's going to help you, to move beyond and help those injuries heal. So often it's pain pills and muscle relaxers and all that. They don't heal you, they make you think. So then you think you're better, and then you go out and you injure yourself even more. So I'm glad that it's going well. So
Yeah, and it's kind of just cool because like he'll tell me stories about like team because he works with like UNCG and high.
oh yes.
And so he'll like,
Yes.
oh
Yeah.
yeah, all the girls have what you have. I'm like, okay, that kind of makes me
Right.
feel better.
Makes you, yeah, that you're not some lone person. No, I was telling your mom, he obviously works with a lot of high level athletes and knows what it takes to, make sure that you're ready to roll on game day. So that's good. There's your buddy again.
Oh my God, can you let go of my shirt?
Like, wait a minute, I want to be in the video.
She's really purring while I do that. She's like, hey.
Aw, she's so cute.
Oh, she's a little rascal. Here, you can
You
look.
are a rascal. Hi, what's your name?
Her name's Kiki, but we don't even call her that really. My mom calls her crazy or psycho. I call her Stinky or Nugget, and then
Oh,
Dad calls her whatever.
whatever. That's so funny. Scotty is our dog, and it's like, oh, snickerdoodle. Oh, it's crazy. I'm like, the poor thing's gonna have no idea what her name is. So
Yeah, I don't think she knows. It's just kind of like,
yeah.
listen, go. Like food.
Got treats. I'm your friend. So
Pretty much how it is.
yeah.
So, what does a starting salary look like?
Yeah, no, that's a great question. I would say probably in the $50,000 to $60,000 range. That's on average. And then I think dependent upon the office and how busy the office is, you might be able to earn a little bit more. I mean, I even looked up some of the wanted, ads and what they're offering right now. And, some of them will obviously do a salary, and then they'll do commission, based on how many patients you're seeing, or bonus, I guess is a better word. And another thing that's pretty customary if you're working as an associate in an office is that they'll pay maybe you have to have malpractice insurance. So they might pay a portion of that. You have to do continuing education every year, 24 hours. Sometimes they'll pay, so some of the incidental expenses that I would have, that the offices will pay for those, which is nice. And some of the larger offices, they might pay a portion of your health insurance, or even some retirement too. So it varies from office to office, but on average, that's about what you would expect to make.
Nice. So, what would you say is your favorite thing about your job?
My favorite, let me just make sure so my favorite thing, and I know it kind of sounds cliche-ish, but just helping people. And I think the neat thing in 23 years of practice is just seeing people reclaim their lives and going from just almost existing to really living. I just had a patient the other day, and she's like, I've been walking for a cane as long as I can remember. And she came in the office without a cane. And just her energy and her eyes. And she's like, oh, I've done things that I haven't done in years. So just seeing people know that that they're able with the care to really do some amazing things. Yeah, I would say that's my favorite thing.
Yeah, that's why I'm like interested, just because it's like from like my own personal experience. I mean, even though I'm like very young, I
Right.
already like have gone and like had like great experiences. So I just feel like that'd be something like really interesting to do, to be able to like help people, but you can also be like hands-on.
Right. Yeah. And you really can, I mean, I think it's not being sexist, I guess, but I think it's a great profession for women, just because, obviously, you have no idea what the future holds, but if you do want to be married and you do want to have children, which is what I've, done, that I've worked part-time, and it's been wonderful. And I've still been able to be engaged with my kids and participate in things. And and the other great thing I think about the profession is you can really, you can be just more of a kind of a general chiropractor, or, how Damien's office, where, I mean, he's high, into athletes, and
Mhm.
from the middle school all the way to the collegiate level. So if you have a particular area of focus, you can really do additional schooling. Like, I'm kicking myself now, but there's a pediatric fellowship. There are a couple of doctors locally that have it, and they are, heavily into treating pediatric patients, which I think is a lot of fun too. So yeah, it is really, it's a neat profession.
Yeah, my mom would be like, Jordan, I think you would be pretty good at this job.
Yeah, yeah.
Like,
Well,
it's
I
really
mean,
interesting.
I think, and I think the cool thing about chiropractic is, I mean, I think so often in our country, we really, when you go to the doctor, and sometimes it's necessary, that we practice a lot of sick care. And I think we, as chiropractors, we can really be a part of what I call true health care, of helping the body function, excuse me, at its optimal level. And so, it's neat to see people's lives change in that respect. So, yeah.
Like even in the when I went to the Healing Hands, like he was just telling me like stories about people who like weren't able to like walk or had really bad back pains, and he put like this little sticker and it had a seed in it, and he put it in my ear. And
Mhm.
then he gave me like some story about how he did it for some woman, and then she came and she's like, I don't have back problems anymore or
Oh,
something.
wow. Oh, I wonder what that, I'll have to ask. I don't see him often,
I
but
don't know what it was. It was like a mustard seed or something. And it's something to do with like part of your nervous system in your
okay.
ear.
Interesting. Yeah, I'll have to ask him about that. That's pretty
He put
cool.
a couple of them in, and I was like, oh, they fell out. And he's like, no, it didn't. Like, it's still there. And I was like, oh.
Still, you're like, oh, I didn't even know. Yeah, that's funny.
So
Very.
what do you find is like the most challenging about your job?
So I think the most challenging, and I think it's pretty, it's across the board in our society, is people looking for a quick fix. They're in pain, they're discomfort, they can't work. And I mean, which rightfully so, with not being able to work, and you can only go so long and not earn, be at work and earn money. But I think our society has just been very programmed to, oh, take a pill and you're fine.
Yeah.
And so I think trying to re-educate people and redirect people that that's not going to truly get you better. That's going to basically fake your brain into the problem is no longer there. And when you stop taking whatever you're taking, that problem, is going to return. So just re-educating people that it's a process and it's not going to happen overnight. You certainly didn't get there overnight for the most part. So sometimes people are not, super open to kind of that long-term commitment or some term of commitment, just because they're ready for it to be gone. So
Yeah, especially with like if you have to do exercises, like I know for me, I have to do exercises like
yeah,
outside of my appointments, like
yes,
every
yep,
day. Like some of
yeah,
them, like I have to do it like 3 to 5 times a day, and it's like just as simple as like following a pen with my eyes, just because of like how I've just kind of like messed my head up from
Right.
volleyball.
Yeah.
So it's
Yeah.
like the small things that you're like, oh, I didn't really think I would like have to do that.
Yeah, I mean, it's time, it's a commitment. And, for one reason or other, people sometimes are, and I mean, it's not like they're bad people or anything. It's just, sometimes they're busy or they just don't think that being that committed is important. So, but anyway, I would say way more, people have been, way more open and willing than the people that who haven't. So anyway, they far outweigh the are difficult ones. So
Good.
yes, it is good. So
I
um,
feel like your most rewarding thing about your job is probably going to be very similar to your favorite thing.
yes, and it was ironic. I just I put number 7, you know, beside number 5. I'm like, yeah, I mean, I think that's it. Just seeing people just live the way they want to live. And so yeah, it's fun. And it's a very positive environment. I think, I'm sure with your dad, you've probably seen him, especially working in the corporate world sometimes. It's just super stressful and can be some pretty tough days. Like, I rarely have that kind of a day. And then obviously it's not my practice. So I don't have to manage people and, get into, so I have a lot less responsibility and that. But I just don't have those days, like that, because it's such a positive and inspiring environment. So, which I'm glad, because I don't think I would survive in the corporate world. Yelling at me or whatever, I'll be like, all right, I'm out of here. So anyway, yeah.
Yeah. I don't think I would like someone to yell at me all the time. Like sports, I can handle it. Like yell at me all
Right.
you want. But then come to the real world, I'm like, no, like I'm such a softie.
Oh, me too.
I'm like,
Well,
don't
and to
yell at me.
me, I'm spending my time away from my family to try to be the best that I can be. Then let's try to work together, as opposed to being in some high pressure, environment. So clearly
Yeah.
that Lord directed me the way that he did, because I think he knew I would not survive. Or I would have been a pretty miserable person if I had gone into something like that. So anyway, so what is next?
My next question are what are some essential basic skills like personality traits
Oh
that are
yeah.
necessary to
Yeah,
work
let's
in the profession?
see. So I think, at the top of my list is just being a really good communicator. I think I talk a lot all day long. I'm constantly trying to educate my patients and encourage them and, teach them. And I try to do it in a way that is not overwhelming, because the first appointment or two, it's a lot of paperwork and it's a lot of information. And I'm sure even for yourself or your parents, they've gone to the doctor and, the doctor starts talking and you just kind of zone, like, you just are like, wait a minute, what did they say? I'm not sure. What did that mean? And so I try to really follow, excuse me, along with them and just trying to just plant seeds and educate and re-educate of what's going on, why they need to be there, and what we're going to do to correct what's going on. Some other things I said, to be empathetic, to understand, and I think it's great for me. I was a patient before I ever became a chiropractor, so I think it was good for me that I had been on the opposite card, the flip, side, wearing a as a patient. For me, or for the type of practice I like to work in, is someone who's really interested in healthcare and not sick care. We talked about that. Compassionate, also positive, because people come in, they're hurting, they're in pain, and they just kind of, some people are just at their wits end, and don't know where else to turn. Patient, and then also good listening skills. I think it's sometimes our habit just to talk a lot, and so it's really good to be able to truly listen to people and not talk over them, because if you listen to a patient, obviously they can tell you a lot about what's going on. So those were kind of the top ones, I thought.
Yeah, especially like when I go, like I feel like so much information's being like fed at me. Like mom and I are in the car, like do you remember what he
Wait,
said?
what?
He said
Yeah,
this
yeah.
word, it started with an A. I don't remember what it was. I was like, I should have written it down in my notes. And I was like,
Well, and Damien's a fast talker too.
oh yeah, he
If
is.
you're not like clued in on him, he says he can say a lot in a short amount of time. So
Yeah.
yeah, it can be
Like
overwhelming. It really can.
like one moment we'll be talking about like whatever he's gonna do, and then the next we'll be talking about him running like 100-mile marathon. Like
Something crazy.
I was
Yes.
like, why would you do that? I was
I
like, I have
I'm
no
like, to
control
me,
over
something better be chasing me if I'm running 100 miles. I'm
yeah,
not.
he's like, I'm not a runner, but I just do it for fun. And I was like,
Yeah,
mm-mm.
he's a crazy weekend warrior person. He is. He does some crazy stuff. So
Yeah, but
yeah.
cool to see all that he does, especially just from like an athletic standpoint, to be able to kind of understand it because it's like, oh, I know how they feel.
Yeah, yeah, absolutely. Yeah, no, he's a specimen. He really is, and he definitely walks the walk. That's for sure. So yeah.
He's definitely a northerner. He's like, I'm from New York. And you're like, that makes sense.
No, are you really?
Yeah, we're like, yeah, we can
No,
tell.
that's funny. Very cool. All right.
So, what are some techniques that you practice?
Yeah, so that's a great question. I think one way to kind of distinguish it in more of a general sense is, when I was in school, we mainly used our hands, which I know Damien does, a lot. Um, and one technique that we learned in chiropractic college was actually a little handheld instrument, and you kind of squeeze it, so it's like a single probe, and of course you can put it, on the spine, and then you squeeze it and click. That's it's called activator, and that's been around for a long time. And most chiropractors have activator in their office. But you can imagine from all that squeezing with their hand, a lot of chiropractors developed hand and like carpal tunnel, and because
Yeah.
squeeze it every time that you want it to click. So not when I was in school, but once I was out of school, some technology came along that's electric. So it's more of a, like, instead of it being like a single probe, it's like it's shaped like a U. So it's kind of a dual probe. And it taps on it. So, or you can direct it, to tap. So it's more of and not a manual per se hands, but an electronic adjustment. So we have both of those in our office, and it's good because we have our patients like you who don't have a lot of decay and degeneration in their spine, and so we typically would do more of a manual adjustment. And then we have a lot of elderly patients as well, or patients who have had spinal surgery and had fusions where you can't adjust them manually. So we have this mechanical electric adjuster. And the great thing is both of them are very effective. I would say with the mechanical adjusting, it takes a little longer just because it's a little easier, on the body, but that's fine. They're both effective. Now under that manual kind of umbrella, and we started, I think, third quarter in chiropractic college, you do learn different techniques. So one of the techniques I practice is called diversified. So that really means that I will adjust any area of the spine or extremities and do that. Diversified means, that you're using your hands to do that. Another technique which I use in the office, and Damien, trying to remember his tables. Obviously, I haven't been in every one of his rooms, but it's called Thompson drop technique. So if you look at the table is it's a full table, but it has pieces that are individual pieces, and those pieces can actually lift up. And I think I've used it with
I
you.
was like, I think it's in your
Yeah, with the
garage.
yes, and it makes a bunch of noise. So that's called Thompson drop, and I like that technique. But I'd say from third quarter all the way up to 10th quarter, we're learning different techniques. So they all, of course, have their names, and a lot of it's rooted in who pioneered the technique, hundreds of years ago when chiropractors were just kind of becoming chiropractors. So the Thompson drop technique is Clay Thompson. And
Mhm.
so a lot of times I think it's just what resonates with you, and what you like, and what you feel comfortable. I kind of base it on what I feel comfortable having done to me, and then would somebody else, and would I be comfortable performing, that type of technique? But it's just a very personal thing, and what you like and what you feel like is most effective. And a lot of times you just take all of that and dump it in a big bowl and that's how you treat your patient. And a lot of times it depends on their presentation, as well, what's going on with them. Like I'll literally have patients that are extreme pain. No way would I ever, turn them up on their side and adjust them that way on a day when they're 10. Now, once they get kind of into that 4 or 5 range, okay, well, we're going to do something different because I can, but you're not as in much pain. But there's lots of different techniques out there that you can use. So
Yeah, I've been learning.
Damien, like he does a lot of the ART, the active release technique, where he's the soft tissue and which can be pretty tender. I know he uses that a lot, but it's good because it's breaking up like the adhesions where the fascia and the muscle, just from injury and trauma. So it's an effective technique. So
Yeah, for me, like he always like massages like my neck because how tense it is from like
tough.
diving and like constantly like being
Yeah.
in the ready position and then like going up and then diving
Yes.
and your neck just
Yeah.
always being like super tense.
Yep.
And so I was
Yep.
doing- I
And
was like,
then
"Oh
of
my
course
God."
these things, this,
Yeah,
and then a student and crazy heavy backpacks and
yeah, my backpack is insanely heavy.
Yes, I know when Olivia and Riley, I'm like, oh my gosh, you guys are crazy. So yeah, I think that's probably as good a explanation technique wise. But there are time, I mean, still after 23 years, like I said, we have to do continuing ed. So
Mhm.
interested in something, I try to find something that, would be something new I wouldn't, want to learn and use in my practice. So a lot of chiropractors do a lot of nutritional, and I'm sure Damien probably does some of that in his practice too. So there's so many focuses that you can, have in your office is really what interests you the most. So
Yeah, and like even when I went like my first appointment, like they kind of made me do like all these like tests, and I was like, these are kind of like silly. Like they call it the floppy fish, and like you basically just go like this with your hand really fast on your leg. And
okay.
like my right hand was really bad at it. And he's like, okay, so this means that this side of your brain is not working
Right.
correctly. And
Yeah.
I was like,
Yeah.
I had no
Because you've had some concussions, correct? Have you? No, you haven't. Okay.
so that they were like testing for that, and then they made me do like the marching one with my eyes closed and
Okay.
like,
Yeah.
moving, and so it was
Mhm.
interesting. I was like, I didn't know that like all of that can really like give you that much information.
Yeah, yeah, there's some neat things. So very cool. Okay. Let's see.
So my last question is, what are
Mhm.
some things that you have to be careful about while working with a patient?
Okay, so that's a great question. So I always tell patients, especially when they first, come in, tell me as much about yourself as you possibly can tell me, in regards to health, in regards to trauma, injury, motor vehicle accident. I feel like the more I know about a patient, the better off, obviously I'm going to be able to take care of them. So really important is a very thorough history. Of course, as you well know, you fill out a bunch of paperwork. And we look over that and, ask any questions where we need further information or need clarification about what's going on, any health conditions that they're currently experiencing or have experienced in the past, any medications that they're, currently taking and how that, would affect their health. After that, we perform, an exam again, which is what you've experienced. And typically, I would say 99% of the people in our practice, we X-ray. We just want to see, an X-ray is a great tool. I know Damien doesn't do a lot of X-raying. He just sees a different kind of patient than we do. Now, I'm sure if you came in and these XYZ were your symptomatology, he might say, listen, Jordan, I want you to go get X of your knee or your ankle or whatever before I start, working, on you. But most people in our practice, we do X-ray. And then also, any prior surgeries they've had. I'm trying to think of anything. If they've had any other diagnostic work like CT scan or MRI, or we have a therapy that we use in our office. And if you have a pacemaker or some other type of health history, then we're not able to use use that. Typically, if you're an active cancer patient, we do not use that therapy either. So obviously it's important that we know as much about the patient as we can, just so we can treat them as effectively, as we can. So yeah.
Most definitely.
Yeah.
This is kind of just like a random question, but are
No,
people
sure.
like ever like kind of funky about like if you readjust their neck? Because like
Mhm.
all my friends are like, ew, you like when they do that? Like, I'm scared they're gonna like break my neck. I'm like,
Right.
no, like it feels so good.
Yeah, no, it does. I mean, we certainly have, I would say there are a few, again, way less than most people love that. I mean, and once you've been adjusted that way one time and you see how effective, it is, and people are like, oh, okay,
Yeah.
but initially, sometimes, and that's why, we have our mechanical adjuster is called the Pro Adjuster. And I'm like, okay, well, if you prefer not to be adjusted that way, then we can use the Pro Adjuster. And I think sometimes people see with the Pro Adjuster because it is a little slower. And then after that, they're like, oh, well, maybe I will try the man. And yeah, I mean, now some people, we have a few that will not let us touch them manually, adjust them manually. And then, of course, we have a lot of patients. They're like, do not use that Pro Adjuster. I don't want, so it's, I would say a few people, and then, after they're under care, they're fine. So they're very few. I think if, again, going back to the education and explaining, the how effective they both are, what I, as a professional, think is best for you. Like if you came in and you had a prior neck surgery, I would say, it's probably a good idea that we don't manually adjust you. We're going to use, the Pro Adjuster. We'll get the same results. It might just be a little longer. But just again, and then also too, I mean, there's a super, 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 super rare. I don't know if any of your research that you've seen, but sometimes they'll say there's a connection between stroke, and with the manual adjusting. And I mean, I think it's like 1 in 10 million. So, and a lot of times when you dig a little deeper into that 1 in 10 million, they'll say, oh, a chiropractic adjustment. But then, and I've seen stories of this, but it was a physical therapist who performed it, but they will say it was a chiropractic adjustment. So, when you see those types of things, which clearly you're a smart young lady, and I know your mom and dad, you have to dig a little deeper
Yeah.
sometimes to get to the, I think with anything in healthcare, there's always a risk. So we always talk to our patients, about that. But I always tell my patients too, I think another good indicator of how, and I don't want to use the word dangerous, of if there's risk, a high level of risk would be my malpractice insurance. And my malpractice insurance is less than $500 a year. So the risk is obviously very minimal. If I were a high risk, like a obstetrician, like if I deliver babies, or if I was an anesthesiologist, I mean, my malpractice is going to be crazy, out the roof as far as pricing. But so anyway, that's really the only thing I feel like with the manual adjustment with the neck. Sometimes you just have to do a little bit more of educating, and with patients, if they want to be adjusted that way, but have a few reservations. It's just like I always say, well, tell me about your concerns, and then we'll kind of go through them like that. So
Yeah, whenever I go, like he'll just like you move your body so awkwardly, and mom's
mhm.
like, I don't know how you move like that. She's like, oh, like, and then you'll hear like the pop. She goes, oh, I don't like that. And I'm like, oh, I'll literally be like, oh, that was amazing.
Oh yeah, well, it's funny. Once you've been adjusted that way, then somebody tries to use the Pro, and you're like, no,
No.
take that away. So, and I mean, I was adjusted manually the first time I was ever adjusted. So that's how I like to be adjusted as well. So, But yeah, so what else? Anything else?
That's my last question, but
Okay.
I'll be sending you a link to like basically just like an evaluation thing, and you just kind of
Okay.
like how our meeting went and stuff like
Right.
that. And it's not
Okay.
long, it shouldn't take you more than like maybe 5 to 10 minutes, if that.
Oh, happy to do it.
Yeah.
Yeah.
Well,
I'm
that's
I'm
it.
always excited to talk about my profession. It's funny, Mike, he's like, I can't stand going places with you. I'm like, what do you mean? And he's like, well, if we go to a party or we go, it's like everybody always wants to talk to you and nobody wants to talk to me about. I, I'm sorry.
Fun.
Yeah. So, well, cool. Well, very good. Well, yeah, if you think of anything else, let me know. And as far as tomorrow, that's convenient for you.
Whenever.
Okay. I'm I, I'm sure you're crazy busy. I appreciate you being willing to help her. Now I will be at work. So what time? About like 4 o'clock?
Yeah.
Okay. So I'll just tell her. She'll expect you. Well, and I'm trying to think. Olivia will be home by then too. So anyway, so she'll be home from school. We have 2 volleyballs. I don't know if you have any
Oh,
extra.
I have like three. I have like an App State one, which is
Okay. Okay.
all, and then I have like my two personal ones. So yeah.
Okay, cool. Well, yeah, so you guys are not having to run around, and I'll tell Olivia and have a lot of homework. She needs to be out there helping you guys. And yeah, she's just really nervous, and it's just so unfortunate with her being quarantined that the way it happened, and literally right during the middle of all of the tryouts, and so they weren't allowed to to do any of them. So she's all bummed and stressed out. But we did send the video of her. So fortunately, at least she does have one bid, and maybe that opportunity to bump up a team, which will be good. So
Thank goodness for technology to be able to do that.
well, Olivia played her first season at Spike Force, so I had reached out to her coach and just was like, "Hey, I want to let you know Riley can't come. This is why. I didn't want you to think we were just like backing out and not showing up.
Mhm.
I always feel bad. I don't want to take someone else's spot that could have come and tried out." And she was like, "Why don't you send a video in?" And I was like, "That is just," and I'm like, even where she's played for 2 years at Beach South, they didn't even like, so I don't know, but it will be fine. It will work out the way it's supposed to
She'll
work out.
end up where she's supposed to.
That's exactly right. And that's what I told her. I said, listen, sometimes, we have in our mind the way that we think it's supposed to look, and, it'll work out. So,
Especially
well,
like
awesome. Well, I hope this has been helpful and in information as far as the profession. And if you think of anything else, let me know.
well, thank you.
All right. Have a great